Good morning and welcome to the Caregiver Teleconnection. My name is Glenda Rogers and I'm going to be your facilitator for today's call on the Caregiver Teleconnection. Today we're going to be talking about the positive aspects of caregiving and touching for sure on caregiving of people with dementia or Alzheimer's disease. Today we have Lucy Barylak with us and Elliot Sklar. So let me tell you just a little bit about them before they get started. So Lucy Barylak has a master's degree in social work from McGill University. She is presently working as a consultant for Health Network in Montreal, Canada. She has been involved in various research projects and has published numerous articles related to caregiving issues. She has lectured and presents annually at international and national conferences. Lucy is also a consultant for private industry in the United States, including her work with the WellMed Charitable Foundation and clinics in Texas. Lucy would also like you to know that she was a caregiver for her mother for about 10 years. Dr. Elliot Sklar is an associate professor of health sciences at Nova Southeastern University in Florida. He has worked as an educator, researcher, and leader of community-based health programs in the United States and Canada for over 15 years. He has a doctorate degree in public health and teaches disease outbreak and investigation, which has been central to the COVID-19 pandemic. Since the pandemic began, he's helped facilitate over 75 sessions to support caregivers during this time for the WellMed Charitable Foundation, the American Public Health Association, and for senior living communities across the country. Welcome, Lucy and Elliot.
Thank you.
Hi. Thank you, everyone, for joining us today. We have a very exciting program to share, which I think is quite unique. You know, often our focus is to support caregivers by acknowledging the challenges that are inherent with caregiving. And as caregivers and healthcare workers, we can often get caught up in focusing on the things that are negative or difficult, and that's really very much human nature. We're used to thinking about what we cannot do rather than what we can do. And so today, our focus is really on the can, and that's why we have it in bold here. You know, we realize that caregiving is certainly an emotional journey because often the close relationships we have with our care recipients makes it so. In addition, there are many elements of caregiving that are out of our control, which is something that is very difficult for people to deal with at the very best of times. One of the difficult parts for caregivers is when the health of our care recipients decline, which is the nature of many progressive illnesses and out of our control. I think also the pandemic has really brought to light many of these issues, and I hope that it will serve as a catalyst for change to better recognize the role of caregivers and to empower them with policies that are supportive of the role that they serve. There's a lot of research on caregiving, and it's often focused on reducing caregiver burden, but little attention has been given to promoting the positive aspects of caregiving. And today, the purpose of our session really is to focus on the positives, and there are many. I wanted to begin with something that, you people probably wouldn't expect as part of this presentation. But I'm curious to know if anyone can identify the person in these photos.
Oh, it's not coming to me, Elliot. I recognize her though.
Marilyn Monroe.
I know. Exactly.
Somebody
Yes.
said it.
Yes.
Somebody
said it. It's Marilyn Monroe.
Yeah.
And the reason that I wanted to include these photos is that they are the product of the publicity department of Fox Studios back in the 1940s. And the Fox Studios had essentially fabricated a biography for Marilyn Monroe stating that she was discovered while babysitting for a Fox talent agent. And these were the staged photos taken to prove that this had happened. And I only learned of this recently in a new documentary, but the reason I share it is because one of the biggest icons of all time was positioned in this way intentionally as a caregiver to make her more likable to the public. At the time, the concept of providing care had a very, very positive association. Now, I realize, of course, in these photos, she's caring for babies and not someone who is sick. But nevertheless, the concept of being a caregiver or a carer was viewed in such a positive way and made known in a very obvious way. We don't really see depictions like this in media today. And so I really wanted to ask for our participants today, do you feel like providing care is valued in our society?
So you can unmute your phone. If you've zoomed in, you can press *6 if you phoned in, or you can put something in the chat box.
I don't really think it's viewed as a positive. I feel like caregivers are ignored most of the time.
Thank you for sharing that. I wouldn't disagree with you. Anyone else?
I do think that it is valued, and thank goodness I have family and friends who value the care that I give for my husband who's had 11 strokes. But people just don't understand what is really involved in all the caregiving. And I think it's hard for them to really want to learn about what it is and what is all involved. I don't know if that's making sense.
Absolutely. Absolutely.
Thank you for sharing that. Does anyone else have anything that they want to add? You know, I really thought a lot about this in putting our presentation together today. And I thought to myself, well, what can we do? You know, if people were to respond, as we have heard by some people, that they don't feel that people really understand the enormous gravity of what being a caregiver is, you know, how do we change society? Well, maybe we can't, and maybe that's not our job. But I think one thing that we can do is to certainly validate and acknowledge to someone that we might know who serves as a caregiver how much we value what it is that they do. So that's just a little one tip of what we can do. I recently had said to a colleague of mine, whom I know she cares for two parents, both of whom have some level of disability following strokes and other health issues. And she was sharing to me what she was dealing with. And I said, you know, I don't know how often it is that your parents thank you, but I want to thank you on their behalf, because what you do is just so incredible for them. And it's something I think that you should feel so incredibly proud of. So I think acknowledging that to people that we might know who serve as caregivers is something that I think can be helpful. I also wanted to ask those participating today, who values the care that you provide?
Jenny, did you have a comment that you wanted to make? I see your phone is unmuted.
Oh, I think I was just agreeing with what a previous person had said about that. I have a lot of friends and family, you know, telling me what a great job I'm doing, which is very nice, but it's really just my dad and I alone here 90% of the time. Most weekends, my husband can make it up to be with us. So it's nice to be thanked and nice to be valued, but sometimes I really could use some help. So I guess what I wanted to say.
Well,
And we had a couple of comments on our chat box, Lucy and Elliot. Debbie says it is viewed, caregiving is viewed as a necessity that someone has to do but doesn't want to do. People feel sorry for caregivers and don't know what to say to them. And then Michelle said she feels like it's undervalued because people don't realize what a huge impact it is on the caregiver. Both of those, you know, I agree with. Thank you for putting those comments up.
absolutely.
All excellent points. And we are going to touch upon actually how to advocate for yourself and ask for help. Lucy's going to discuss that in a moment. But I have one last question for everyone before we proceed. And I want you to think about the statement that I've posted here. I'm grateful to be blank's caregiver because. Now think about this in relation to the person or to the clients for whom you provide care. We're going to circle back upon this later in our program, but I was curious if there's anyone who might want to share now how they might complete this statement.
Sandy, did you want to comment?
Yes, I can. I am grateful to be my husband's caregiver because I believe this is where God wants he and I to be in our lives together.
And Svetlana, did you have a comment? Well,
Yes. Good morning.
good morning.
Good morning.
Did you have something you wanted to add?
No, not yet.
Okay.
I'm a very beginner. I'm just in the process of setting up caregiver program, but I want to educate myself on that.
Okay. Thank you very much.
Well, I really have to say that all your comments are so valued. I can certainly relate to them as well. And I wanted to thank you, Elliot. Those were very good questions to think about. And I really thought about why I was grateful for to be my mother's caregiver. And we'll talk a little bit about it later on. What I want to focus on today really is the whole idea of acceptance can bring out the positive aspect of caring. So let's look at what is acceptance. Acceptance is necessary for your healing process. To practice acceptance, you must acknowledge all the uncomfortable parts of yourself, your emotion, your thoughts, and your past. A recent review in 2019 examined more than 50 studies to explore how positive aspects of caregiving can have a benefit on your well-being. That included personal growth, gratitude, mastery, finding meaning, knowing that their loved one is getting good care, letting go of anger and guilt. Instead of simply dealing with the negative aspects of caregiving, focusing on the positive may help caregivers stay healthy and provide better care. So the review examined studies that investigated those types of positive aspects and their relationship to caregiving's mental, physical, and emotional well-being. And I was surprised to find out that, as it turned out, more positive aspects of caregiving were associated with fewer symptoms of depression, less anxiety, and less stress, as well as better psychological well-being, mental health, emotional health. And some studies also reported benefits to the quality of life, as well as reducing caregiver stress. I read a really good article by this therapist called Megan Bruno. You know, she talked about accepting does not mean liking, wanting, choosing, or supporting. No one is suggesting that you like, you want, or support whatever it is that you're accepting. It does not mean that you've chosen or endorsed what you are accepting. It doesn't mean you like your anxiety or the injustice that happened to you or your loved one. Rather, you're choosing to accept the situation and accept your loved one's present physical and mental capacities by accepting the situation for what it actually is in the present. You know, so acceptance is an active process. It must be practiced. So remember that acceptance is a verb. It's an active process. One that must be practiced consciously. It's rare that we one day choose to accept our emotions or physical pain or our past and never think about it again, or the caregiving difficulties that we are going through. You know, it requires oftentimes, it requires a lot of times. It can be frustrating at times. By practicing, you create and strengthen pathways in your brain. It's really natural to vacillate back and forth between feeling of acceptance and feelings of resistance. It does take time. I'm telling you that because I practice it, and I'll tell you a little bit more about that later on. Acceptance doesn't mean that you don't work on changing things. You know, many people believe that acceptance is a sign of apathy, passivity, giving up. However, this doesn't have to be the case. Practicing acceptance does not necessarily mean you won't be able to make a change. You can accept your body and still change it. Accept your emotions and acknowledge them. Accept your behavior. Accept your loved one as they are and not how they were. Acceptance doesn't mean you're accepting it's going to be that way forever. For sure not, especially when you are a caregiver going through your caregiver journeys, the ups and downs of caregiving. Try to focus your acceptance on the present alongside an open and realistic gaze at the future. Take one day at a time, very important. But sometimes imagining practicing acceptance forever can seem daunting, overwhelming, or impossible. So try to find the sweet spot where you're accepting the current moment. The joy, the smile, the happy time with your loved one, knowing that they are well cared for and that the relationship has changed by creating new ways of interacting with your loved one. You know, we can practice acceptance towards our experience, people, appearance, emotions, ideas, and more. You know, again, this doesn't mean you necessarily endorse whatever it is that you're accepting in these realms. Rather, you recognize that you can't change the current nature of this moment, and accepting manages, and you know, that really manages your anxiety and helps you accept the present as well to, you know, to get rid of some of the anger and frustration and know that you are doing the best that you can for yourself and your loved one. So I encourage you to consider how to accept the benefits that you've had through your life and how you can practice it in the moment. So I just kind of like to share a little bit of my own personal experience. I was a caregiver for my mother for 10 years. She had many physical and cognitive difficulties. And I have to say, as a human, as her daughter, only child, I worked, I had a family, I felt a lot of the emotions that caregivers go through. There was, you know, I was angry at times, frustrated. But one day something happened. I looked at my mother and I realized that she wasn't the person that I knew. My mother had changed. And somehow I had to accept it. And I realized just accepting it wasn't enough. I had to develop a relationship, a new relationship with my mother, a relationship where my frustrations, my anger, my, you know, my sadness more than anything. And so I really looked at redirecting, and when she was acting in a certain manner, how can I redirect that, not get angry, not take it personally? And so very quickly, I learned that I had to engage with her in things that she was able to engage with me. She loved having her nails polished. She loved having her hair done. So we did that. She chose the nail polish. She chose what hairstyle she wanted. It was a process. Now, don't think that I didn't have moments where frustrations and anger kicked in again. But I think when I finally accepted my mother and not blamed anything but the disease and what was going on, my life with her really, really changed. And I have to say that when she passed away, I didn't have to deal with any anger or frustration. I did the best that I could. So,
That was very powerful, and thank you for sharing that. I was wondering if anyone participating today has any comments or anything that they would like to share.
You can just unmute your phone. If you dialed in, you press *6 and that unmutes your phone and I'll be able to recognize you. Nancy said that her therapist helps her with acceptance, so she has sought help, and I think that's a great thing too.
Absolutely.
Nancy, you wanted to say more about that?
Well, yes, and she calls it radical acceptance, and it's and it's taken me, oh yes, quite some time to get it, to understand it. I'm a meditator, so I meditate every day, and that really helps me too. And I just finished a book called The Book of Joy, which has nothing to do with dementia, but everything to do with how to accept life. And it's written by it's from the Dalai Lama. And being that Buddhism is not a religion, it's okay for anybody to read it. But it was transformative in my life. It really does help me with acceptance and with changing my view of things in life, my lens.
Such a nice way to put it.
I was just going to say that, and I'm so grateful for you sharing that and for your own personal growth process, and acceptance process.
Thank you.
Thank you, Nancy. Anyone else? Just unmute your phone and you can join the conversation.
Lucy, I just want to thank you for sharing that part of your journey, and appreciate it. And my husband has said to me several times, well, you don't mind doing this, and I won't go into the details about, everything that I have to do, being accidents and changing him and everything. And many times a day, and all the laundry associated with that. But so he said, well, you don't mind doing this. And I've said to him, well, yeah, I don't like it, but that doesn't mean I'm not going to still do it and be here for you. So, thank you for sharing that part, because I think that's important to acknowledge that we are choosing it, but we didn't necessarily choose to be in this situation from the beginning, nor did our caregivers.
Exactly.
Care receivers. Yeah.
When we accept, it's not that we're accepting what's happened to us or to our loved ones. It's just the acceptance has to do with the reality of the moment, of where we're at, and to be able to deal with our anger and frustration. Thank you for sharing that. That was really also powerful, what you just said, and honest, and so honest, to be able to validate your feelings. It's not something that you enjoy, but you do it because, you care and you love. And
So true. Anyone else?
Edith, thank you, Lucy, for sharing your acceptance, and it was a great tip. So I wanted to pass that on too.
thank you.
Melissa, did you have something you wanted to share?
Yeah, real quickly, because I'm actually driving with my mom, who I'm taking care of, that has dementia, but I'm at a standstill, and I didn't want to miss the presentation. But just wanted to say, yeah, with acceptance, I think that's really key, and that's what I've been actually dealing with this week, because it has been quite difficult. I really didn't see this coming, but I think accepting it, and like you said, you didn't bring this on, but my motto now, it is what it is, and I'm just going to deal with what's in front of me. So that's been helpful.
Thank you, Melissa. Be careful out there.
Yeah, I'm at a standstill, so don't worry. I'm out. Yeah.
Thank you for your comment, Melissa, and thank you for joining us.
You're welcome.
Sandy, you had something additional?
Well, it's just something that a friend of mine at work had shared with me, but this is important, certainly in caregivers, that it's okay for today. And that just has helped me get through, if people are thinking about, there's so many decisions involved, and it's okay for today. And unfortunately, there's a lot of people, they think they're being helpful, but they will often ask, well, what are you going to do if this happens? What are you going to do if, and I've just spent the last 4 years trying to really focus on the present, not that you're going to ignore and not make preparations for the crisis that might happen, but try to try and stay in the present. I just really agree with that, of how important that is and helps you get through the day. So it's okay for today.
Thank you,
It's okay
Sandy.
for the moment.
I
Yes,
love
Yes.
that. I
Yes.
love that.
A lot of good self-messaging going on here.
for sure.
Well, I'm going to move forward because I think we're along the lines of where I was headed, and this is really to talk about exercise, because I know this to be true for everyone. But when caregivers are healthier and feel better about themselves, there's a greater inner reserve to draw upon to support caring for someone else. That's why I've always believed as much as possible in the power of health behavior. When we engage in behaviors that support our health, we're showing ourselves care, and we're also being our best selves. Now, this isn't to say that I don't enjoy my coffee or my wine or my cake, but I also strongly believe in the power of nutrition and exercise. I think that exercise really provides an outlet. There's no magic cure for the demands of caregiving, but many caregivers may find some relief and relaxation via exercise. There's a lot of research that has shown that caregivers can find health benefits and stress relief in everything from yoga to running marathons. And for caregivers struggling to find simple ways to fit activity into your daily routine, we have a few suggestions that can make an impact, I think, on your overall well-being without overwhelming your list with one more thing to do. And as Nancy shared earlier, meditation is one such example. Strengthening and stretching your muscles while calming your breath is good for everyone, and actually especially good for those providing care to someone else. There was a recent study of Alzheimer's caregivers, and UCLA conducted that study and found that meditative yoga practiced regularly for 8 weeks had shown improvement of depressive symptoms in 65% of their studied participants. Yoga and meditation instruction online now make it easier, I think. You can look on YouTube and find classes that you can take. You can even do it on your phone, which is amazing. Another really simple one is walking. It's a wonderful form of physical activity that requires no equipment or extreme exertion, but can have really significant health impacts. In fact, a regular routine of brisk walking, which can start as little as 10 to 15 minutes a few times per week and slowly increase to 30 to 60 minutes, can help to lower blood pressure, raise good cholesterol, reduce body fat, but most importantly, in my it gives your mind a chance to relax. What I thought was interesting was that some research found that weekly exercise classes were very helpful for certain caregivers because they found relief in knowing that they had a regular break to look forward to. And that actually made a lot of sense to me as I thought about it. Regular exercise classes, which can include everything from a dance class at the gym to water aerobics at a community center, they're a source of stability in a routine and an escape as well from the everyday rigors of caregiving. So I think if this is an option that people would like to explore, and if you worry about respite, for example, this might be one of those good instances where it's worth finding respite care for a couple of hours, or finding a family member to coordinate with you so that you can take that time for yourself. Now, everyone is different, and we need to find things that work for us. I found that doing online stretching videos at home with the person for whom you are providing care can be wonderful because you can both engage in the activity as much or as little as they're able to. There's no need for respite. All people can benefit from activity, and we shouldn't forget that fact, that all people benefit from activity when it comes to our care recipients if they're able. So chair exercises are super helpful. Simply lifting up your legs and clenching the buttocks, for example, for 15 to 30 seconds is amazing. So if you are sitting right now, Do this with me, okay? Straighten out your legs and raise your toes high as you're comfortable and clench your buttocks. You can do it for as few seconds or as many as you can, and release. And you just, keep on practicing that. Another great one that I do if I'm in Zoom meetings at home are ab crunches that you can do in the chair. So if you have your knees bent and you're in a normal seated position with your toes and your feet on the floor, raise your feet up with me and keep those knees up just an inch, half an inch even off the floor, and squeeze your abs. You might also feel that in your thighs. Hold it for a few seconds and repeat. There's a ton of different exercises that you can find to do in a seated position. And the point simply here is that it's good for everyone. Stimulates circulation, which we know is so important for dementia and Alzheimer's patients as well. The other thing I want to remind everyone is how important nutrition is. And I'm not sure if you knew, as Lucy's taking a sip of water, but most of us are actually chronically dehydrated. And dehydration can lead to headaches, but very importantly, imbalance and fatigue, and all of which are very important for caregivers and for caregivers, especially who have people depending on them. Now, someone with dementia may also become dehydrated if they're not able to communicate or recognize that they're thirsty, or if they forget to drink. And these can also lead to headaches and increased confusion, urinary tract infections, and constipation. These can make the symptoms of dementia and Alzheimer's worse. So I love the idea of having these reusable water bottles with straws for yourself and your care recipient. If it's too heavy for them to hold, you don't have to give them the whole thing, but it's a great way for you to be able to measure the fact that they're consuming enough fluid. You can get them really cheaply on Amazon or even at your grocery store. And it's just another example of practicing good health habits together. You can even use those water bottles to do arm curls. So there's a lot of versatility with things that are good for your health and ways to practice good habits together. And some of our participants might have heard of the MIND diet, which has also been linked in some studies of Alzheimer's patients to slow cognitive decline. Now, although there is no research linking the MIND diet with reversing Alzheimer's and dementia, there's plenty of evidence supporting the connection between diet and preventing or slowing the progression of the disease. The MIND diet is an acronym that stands for the Mediterranean and DASH intervention for neurodegenerative delay. It's a hybrid of the Mediterranean diet and the DASH diet. And research has shown that it might reduce the risk of developing dementia or slow the decline of brain health in a study that was published in the Journal of Alzheimer's and Dementia. Now, the MIND diet focuses on the intake of plant-based foods and limiting the intake of animal products and foods that are high in saturated fat. You might also have heard of the blue zones, one of them being Loma Linda, California. And people in that area tend to consume more of a plant-based diet, and they tend to limit or not eat at all any animal products. So there's an emphasis on plants. And what's noteworty, I think, is also that this diet specifically urges a higher consumption of berries and green leafy vegetables. So here's a list of the MIND diet do's and don'ts, and you don't have to worry about writing everything down. We'll be providing a copy of this presentation for our registered participants. But fueling up with flavonoid-rich produce may indeed benefit the mind. We've heard great things about blueberries, strawberries, blackberries. They appear to prevent cognitive aging. And likewise, there's a link between eating leafy green vegetables like kale, spinach, or collard greens with lower inflammation and oxidative stress, two factors associated with Alzheimer's disease. And this is according to a study published in the Journal of the Academy of Nutrition and Dietetics. Both types of food are rich in antioxidants and can help to reduce inflammation and oxidative stress. There's also research that was actually just published this past month about the role of selenium in memory. And the study showed strong evidence that selenium improved cognition. but you should not be running out to buy supplements. Too much selenium actually can be harmful. So I really recommend Brazil nuts. They're an excellent source of selenium found in food. We always recommend that you speak with your doctor and even consult with a nutritionist before making any dietary changes. But there's certainly no harm in trying to eat a healthier diet that can benefit both yourself and your loved ones. And I know that for some people who have Alzheimer's disease, proper nutrition can be a challenge for a variety of reasons. There are some very creative ways that you can integrate some of these ingredients in a covert way, like in smoothies or soups. And these are also examples of foods that are high in moisture, which is something very good for dehydration.
Wow, that's a lot of amazing information to take in, Elliot. So before we go to our next topic, I'm just wondering, does anybody have any comments to make? Or I know just for myself, about a few weeks ago, I started to stretch regularly every morning. I cannot tell you how I feel. It's amazing the power in that. And I just did it on the internet. I found someone that I liked. Very simple beginner stretching exercises, nothing overwhelming. And the way I felt afterwards, it's like, as we age, we get a little bit stiffer, right? And so it was really beneficial. I have to say that for sure. Does anybody have any comments to make about diets and what Elliot was talking about?
Diet and exercise and all good health behaviors.
And Lucy, don't forget the benefits of dancing.
Oh, Glenda always makes fun of me. One of the things during the pandemic when we were in total lockdown, especially here in Montreal, it was very restrictive. My exercise every day was dancing in my living room. I would put on, I liked Latin American music, and there I was for a good half hour. It just relieves everything. First of all, you feel kind of young and in the moment. You can be yourself and not care what anybody thinks and just stretch those muscles and dance away. And music is such an amazing way to release your stress.
And I'm not making fun of you, Lucy. I just didn't want you to forget to mention that. I've gone back to line dancing myself, so I'm in there with you.
Good for you. Good for you. And one of the things that Elliot was saying during the pandemic, and I think it's important for caregivers to keep in mind, is to keep routine. Routine is very important, meaning scheduling all these wonderful things in your schedule of exercising with your loved one. I used to do a lot of those exercises with my mom in the chair because she would follow me and we would giggle and laugh at the same time. And that was very helpful.
Melissa said that she agrees with the benefits of exercise. She said she even got her workout in this morning. And so I thought that was great. She probably has a routine that she regularly does also.
Does anybody have any other suggestions that you have for the rest of us of how you're managing your wellness program of eating or exercising? What is it that you do?
Just unmute your phone and speak right up. If you called in on your telephone, you can always press *6 and that will unmute your phone. Nancy, you had another comment.
Yes. I can tell the difference on moods when I'm exercising and when I am not. So I do try to walk at least 5 times a week. And I also bought a stationary bike. So I do have a routine. I go on YouTube all the time and just put in stretch exercises for seniors. And my husband does it with me. And it's amazing how much better we feel when we do that.
Yeah, so true.
That is awesome. That is so wonderful. I think that there's a division. I used to exercise for keeping my weight down. And now, if you looked at me, you would never think I go to the gym. but I'm there 5 times a week because of what it does for my joints and my mental health.
For sure. Thank you, Nancy.
Welcome.
Anyone else have a comment they'd like to make? Looks like
Okay.
everybody is still muted.
All right, we'll continue. We're talking about difficult behaviors. So I just wanted to review what are difficult behaviors, especially when somebody has any form of dementia. They may be agitated, angry, refuse to change their clothes or bathe, refuse to take their medication, be physically, sexually, and emotionally aggressive. So what I want to say about that is really, it's very, very important if you're experiencing any of those things that are just coming up, for example, okay, maybe it's something new. You must get in touch with the family, the primary healthcare provider as soon as possible. Because if it's something new, all this agitation and this physical or emotional abuse or even sexual abuse, something might be going on. The person can be having they might have a urinary tract infection, something new, maybe a new medication that you didn't even realize they were prescribed, or they're over-medicated, under-medicated. So right away, you need to get in touch with the healthcare provider and make sure that you get the support that you need in your community. And always have a plan of intervention if it gets out of control. However, let's say the relationship that you have with your loved one doesn't go to that point. Maybe they're agitated, but they're not lashing out. So it's important to talk about certain, how to sort of, we're talking about looking at different ways of dealing with your loved one. So it's important to acknowledge and validate your loved one's frustration, okay? Something's going on, just as you would want to be validated, recognize it. Don't argue or confront your loved one, okay? Don't argue with them at that point. Stay calm, convey a sense of reassurance and comfort. Try to distract your loved one with another topic of discussion or activity. I can get into a little bit more, more information about how to do that. They are frustrated. Maybe they're seeing something that's not there. Maybe they're hallucinating for the moment. Maybe they're frightened. Maybe they don't recognize you. Maybe somebody came to visit and they're just upset about that. So I think if Elliot, if you can put on the next slide, we can kind of go from there and talk a bit and have people a little bit talk about it. So does anyone have any questions about how to handle difficult behaviors? And maybe you have some tips that you would like to share.
Please just unmute your phone if you'd like to join in.
So has anybody experienced any difficult behaviors with your loved ones?
Yes, Andy.
Oh, yes. A lot of, actually, my husband has more delirium than dementia.
Okay.
And it's just very, would imagine most of you know that, the difference is that they really, his neurologist said it's not hallucinations. He really believes that those things are happening, that he has to get up and go to work or, drive the car that he certainly can't drive. And so it's very hard to do the distractions because he really believes that needs to happen. So I try to just slow down, even though he has diabetes, that I will give him a snack or give him breakfast and say, even if you have to go to work, you still need breakfast first. And sometimes that works, but oftentimes it does not. And that, it's definitely true that you had said earlier about you have to really think if things are getting worse, that there's a very good chance that there's a UTI. And I've seen that really decrease just with even the first dose or two of antibiotics. So
Mm.
not that you want to do that if it's not necessary, but certainly if the doctor thinks that that's what's happening and just can prescribe that can help a lot. So yeah,
Absolutely.
I need other tips of how to distract, because they certainly can't. I've read some places where they'll say, well, if somebody wants to go out, maybe you can put them in the car, but my husband has like 70 pounds on me, and it's a big deal to get him into the wheelchair, get him into the car, and then to go out and drive. So a lot of those things that might work for other folks just have not found that those things work for us. So any tips that anyone has, yeah, I would love to hear those.
Sure. Yes, if anybody has tips, I'll give you a few that I have, but if anybody has tips, I'd love to hear from you. Okay, look, sometimes it all depends on the person's personality. You're saying that your husband is very set in his ways, possibly. And so it's redirecting. It's like changing the subject, if at all possible, by saying things like, if, I just want to see something on television. Do you mind coming with me? Let's turn the TV on. These are just little nuances that you can use. It's not major things that, if it's easy to say, I'd love to go for a walk, and if he wants to go with you, that would be wonderful. But to really just start kind of look at it and distract them, or say, you know what, I'm really craving to have a cup of tea right now. Would you like to join me? We'll have a tea together. Let's make it together. The idea behind all of this is your calmness, your voice, your soothing voice that can go along with it. Because no matter what they're suffering from, they can still identify possibly to themselves that your facial expression, your anger, whatever it is. So it's being able to do that, to suggest activities that possibly you think that your husband would enjoy and might not necessarily want to go for a walk, and you can get him, but a little something. I think that humor is amazing. It worked with my mother all the time. I would say things like when she was distracted or agitated, I'd say, oh, you know what? I used to call her Ima. I would say, Ima, I just heard this really, really funny thing that happened. And I quickly want to try and see something that, either a joke or something. And that kind of snapped her out of it for that particular time and space. So it's something that you just have to kind of, and talk, or you could say things if you have family members, if you have daughters or grandchildren, you could say, grandchild, maybe the name is Michael, Michael called, he was asking about anything that you can kind of get that person a little bit out of where they're at. It doesn't always work, but many times it does. I hope that's been helpful.
Stacy, did you have a comment?
Can you hear me?
Yes.
Okay. Hi, good morning. I just wanted to say I took care of my dad. He had a stroke, and he also had cancer, prostate cancer. And at the time I was working in the police department, working midnight to 8. So that was difficult. But fortunately, there's a nurse next door, and I paid her to take care of my dad during those hours. And the situation would be that I needed to rest. So I'd be a little bit irritable from the job. And when I would come home, I would take care of my dad, feed him and everything. And then when you want to sleep, I gave him a bell to ring, like if there's an emergency, needed something. And then he would ring the bell So 10 minutes, and the next thing you know, the bell. So I'm like, oh God, Dad, I need to sleep. So what I wind up doing in a 2-3 months period, I contacted the adult daycare center. So I got him involved in some activities so he could meet new friends, play checkers. They provided a beverage and food and things like that. And then on the weekends, I decided to go away for a day or two and hired a nursing agency to get some breaks. So that's what some people can do if that's possible.
Those are extremely, extremely good suggestions, you know.
Hello.
Yes,
Hi.
go ahead.
Hi.
Michelle?
I was just going along those lines. I am a respite care worker where I do respite care, that I go into the homes of the caretaker. I'm a caretaker for the caretaker, that when they need a break for 4 or 5 hours, I go in and take care of the loved one. And also I work in adult daycare as well. Some of the things they do is do like musical, play music for the clients when they're agitated. They go ahead and, just do conversation, like ask them about memories and old things in their life, their kids and things like that. We have one that loves babies, so she has a baby doll that calms her down. So yeah, I mean, that is a good option to go ahead and look into respite care or either adult daycare, because there they do activities with the individual that keeps their mind active like throughout the day.
Thank you, Michelle. Respite is so important for caregivers, right? Lynn says one thing she's tried is saying, hey, and then her loved one's name, I need some help, and would you help me do whatever? She said that has helped sometimes. And then Linda says she has 2 of his bros on call that will call her husband. This is really a good one. If she texts them, it's great distraction and redirection. Boy, I love that one, Linda. That's a great one.
Fabulous tip.
It is
And
a
I know someone who does that as well, and it's very, very effective.
Really good. Anyone else have a comment, a question, or a tip that they'd like to share? We're getting some good ones. Oh, we have about 5 minutes left, Lucy and Elliot. So
Go ahead, Elliot.
All right. So we know certainly that not every day is going to be a walk in the park, but it's so important to try to live in the moment. It's okay for today, as someone said earlier, and I love that. There will be good times and not so good times, but we have to remember that when people have short-term memory loss, their lives are really made up of moments. We're not able to create perfectly wonderful days for people with dementia or Alzheimer's, but we can create perfectly wonderful moments that put a smile on their faces and a twinkle in their eyes. And it might be that 5 minutes later, they won't remember what happened, what we said or did, but the feeling that we left them with will certainly linger. And I think the same holds true for us. So I would really, really encourage everyone to write down one happy moment with your care recipient that resonated with you each day, if you can, for a week or routinely, and see what the sum of those experiences looks like. I know that it can seem trite, but it's a practice that really does work to reframe our focus. So with that, we come back to our statement earlier. And I was wondering if anyone has any questions or comments, or if they would like to complete this statement after our program today, maybe something that came to mind.
Hi, my name is Victoria.
Yes, Victoria.
And this is the first time I joined your group, so thank you so much. I've learned a lot. Just starting this whole issue with dementia and Alzheimer's or whatever it is, I don't know yet, but I appreciate everything what everyone has shared. I'm going to try to put this on the calendar so I can start sharing or being a part of this again, because I sometimes get over bogged down, and then I feel like, you know what, you need to do this. It's okay. So I guess I'm just going to say I'm grateful to be my husband's caregiver because I learned today not to be so hard, but at the same time, I do need to work on some of my things that are not nice about me, and my anger, and just know that I've been given another opportunity. So with this learning, I'm just thankful to the Lord, and I can continue on being better for him.
Thank you, Victoria. Please do come back and join us. You're not alone in this.
Thank you.
Definitely not. That was very touching, very honest. You know, we always say, acknowledge your feelings. Don't be embarrassed to say anything. If that's how you feel, it's the beginning process of getting better, of dealing with things.
And I want to make sure to wrap up by providing our resources, because we always end our session with resources. And this week we have a very important resource. And the resource is that you already have it within yourselves. And most people don't recognize how much we possess in terms of resilience and strength. And I want to personally thank each and every caregiver who's participated today or listening in for the role that you serve. And thank you so much for participating today.
And if I may, can I just fill in that sentence, because it really meant something to me. So I was grateful to be my mother's caregiver because I loved her and still do, and wanted her to have a good quality of life, and to be well looked after, because she took care of me in that same way. And that gave me a lot of inner peace, I have to say. Thanks for that question, Elliot.
Yes. And Jenny said she's grateful to be her dad's caregiver because he took wonderful care of her and of her goals and dreams. And now it's her goal to take care of him. Jenny, thanks for sharing that. That's really beautiful. I'm sure you're not alone in that. Lucy and Elliot, you have a session tomorrow. Would you like to say just a little bit about that as we're closing?
Sure. There's been so much conflicting news coming up about COVID and what restrictions are lifted and not lifted and where we're at. So we're going to talk about that, and also the staffing shortage in long-term care and what caregivers can do if they have loved ones in long-term care.
Excellent, valuable information. So those of you who have joined us today, I want to thank you. I want to tell you that you will be receiving a post-session questionnaire, and I encourage you to take the couple of minutes to complete that. Along with that email that has that questionnaire, you'll receive the resources that Elliot and Lucy have presented today. If you have not registered for the session and you're used to just joining in, that's great. We're glad you're here. But you can reach these resources by calling our customer service representative. Let me give you that toll-free number. I did post it in the chat box earlier, but let me give it to you again. It's toll-free at 866-390-6491. She'll be happy to help you with those resources if you need help getting to any of the podcasts. Also, I see Tina has put the link to where you can register for tomorrow's session that Elliot and Lucy were talking about. So I want to thank you again for joining us. I want to thank you for what you do for the persons you're caring for. And I want to especially thank Lucy and Elliot for being with us today. Bye-bye.
Thank you so much, everybody. Take care of yourselves. Be well.
Thank you. Bye-bye.
Bye.
Bye.